I was American born and I'll die in America.
Welcome to our group.
Welcome to Defenders 7. If Defenders 7 has sound, and this ought to show it right here.
Do you or someone you know suffer from depression? If so, please contact the National Suicide Prevention Lifeline at 1-800-273-8255.
Good evening, everybody, and welcome to another one of our wonderful shows here through the Defender 7 with your host, Colonel Kimberly PURVIS, and I'm your co-host and general of the Defender 7, Bobby Ormsby. Welcome, everybody. Hope everyone's having a wonderful night. Before we get on with the show, I need to read a disclaimer. The views and opinions expressed on Defender 7 radio show and Facebook page are those of the callers and or authors and do not necessarily reflect the official policy or position of the Defenders 7. That being said, a lot of our stuff is opinions, and some of it is factual, and our medical show happens to be factual. Now, for those of you new that are just tuning in, we have a website. If you type in all lowercase letters, www.defenders, Roman numeral V as in Victor, with 2 small i's.com. On our website, you'll find our store and a donate button. 100% of all proceeds from sales from our store and donations go back to our communities throughout all 50 states in a time of need. Yes, we give 100% back. A lot of groups out there keep 90% and only distribute 10%. We're not them. So purchase something from our store or click on that donate button, donate $1. Every bit helps. Come on out and help us to help you in a time of need. That's the only way that we run Defender 7 is through donations and sales from our store. We can also be reached on MeWe by clicking on organizations and scrolling down and clicking on Defenders 7 Humanitarian American Patriot Group. Or go to our national Facebook page, type in all capital letters in the search box, Defenders 7. Now, before you hit that join button, just know that we expect all of our members and our future members to participate in everything we do here with the Defender 7. That's meeting your community, meeting who will have your six in a time of a shit hits the fan situation, training for disaster relief, survival skills, you name it. Now, if you feel we're not the group for you, you can always leave with no hard feelings. But come check us out. Now, for tonight's show and all the shows we do here on Blog Talk Radio, we enjoy it when you call in and give us your opinions and your thoughts. Everybody's opinion counts. And that number to call, area code 914-205-5773. Come chat with us. That number again, area code 914-205-5773. Phone lines are open, folks. Come on and call in. And I'm here to introduce you and turn the microphone over to your host, our Colonel Kimberly Purvis. And we also have Captain of Wisconsin, Lorna Munson.
Wisconsin.
Wisconsin.
I was just going to say that. Wisconsin.
I thought you were boiling eggs.
I am boiling eggs. I got it on a timer. No blowing up eggs.
She's going to burn
the eggs. Well, tonight I picked autoimmune disorders and diseases, and if we have time, I'll just pick something else to go into. What the hell? I try to get as much information as I can, and I did post the website from where I got all of the information. I got Medline Plus, and I hate to say it, WebMD, but still, and Healthline. Now, it's a going joke. I hate WebMD, not for myself, but for people who know absolutely nothing in the medical field, because by the time they get done with WebMD, they've got every disease in their freaking website. So,
yeah, Lorna.
It's not.
I missed that. I was letting the dogs in.
It's not uncommon because everything has the same damn symptoms. You know, nausea, vomiting, constipation, diarrhea, headaches, blurred vision, dizziness, shortness of breath, and hell, I mean, everything has the same, unfortunately. So if you have any symptoms of anything that's, for a prolonged length of time, shut up, Bobby. Make sure you make an appointment to see your doctor. Because what are you laughing, dude? You better...
That song.
Huh?
That song. You don't remember it? You never saw that commercial?
The Pepto song?
Yeah.
The Pepto song, the constipation, nausea, diarrhea? Yeah, I know. That's why I laugh every time I say it. And we did too when I was in nursing school. My teacher would go through and she'd sing it, and I'm like, oh, my God. But autoimmune disorders, and I did learn some things about some autoimmune disorders that I have and didn't even know it was an autoimmune disorder. Who knew? So I can't know everything. I try to, but, it doesn't work that way. So autoimmune disorder occurs when the body's immune system attacks and destroys healthy body tissue by mistake. And there's more than 80 types of autoimmune disorders. No, we're not going over all 80 of them. Now, if anybody has one and they need any extra information, call in. I'm more than happy to help you look up information and check it out for you. So the causes, the blood cells in the body's immune system, that helps protect you against harmful substances like bacteria, viruses, toxins, cancer cells, and blood and tissue from outside the body. And these substances contain antigens, and the immune system produces antibodies against the antigen. So a lot of times people freak out when you get a fever. Oh, my God, I got a fever. So usually they don't worry about a fever until it's over 101.5. Now, with this pandemic going around, the temp was 101.5, and now they're saying 99. I personally, when I had it, my temp went from 99 to 100, 101, back and forth, and then it ended up going to 103. But when you get a fever, it's your body's way to fight off whatever it is that's attacking it. So, and that's normal, unless, like I said, unless it gets to 102, 103, you start burning brain cells for a prolonged length of time of you being at that high temp. So when you have an autoimmune disorder, your immune system doesn't distinguish between healthy and potential harmful antigens. And as a result, part of your body tissue or whatever is destroyed. So, nope, they don't know what's the exact cause of autoimmune disorders. So, but like their theory is that some of the microorganisms, even medications, may trigger changes that confuse the immune system. So having an autoimmune disorder may destroy parts of the body tissue. You can have an abnormal growth on your organs, a cyst or a tumor. But all tumors are not bad, so don't panic. You can have changes in organ function. And an autoimmune disorder may affect one or more of the organs or tissue types, like your blood vessels, connective tissues, your endocrine glands, such as your thyroid or your pancreas, your joints, muscles. It could damage your red blood cells, even your skin. And let's see, you can have more than one autoimmune disorder, which sucks. But here's just a simple list of the top autoimmune illnesses that people have. Addison's disease, celiac. I did not know celiac was an autoimmune disorder. I just thought it was, you're just up shit's creek. Dermatomyositis, Graves' disease, Hashimoto thyroiditis, MS,
Hashimoto,
myasthenia gravis, pernicious anemia, reactive arthritis, rheumatoid arthritis. This is some Sjogren syndrome and lupus and type 1 diabetes. Now I'm going to go over each of those because, let's see. So Addison's disease. Okay. So what causes Addison's disease is the adrenal glands are small hormone-releasing organs that sit on top of your kidneys, like little gnome hats. The garden gnomes, that's what they look like. And that's how I can describe it, okay? They're made up of an outer portion called the cortex, and the inner portion is called the medulla. Wow, how they reuse names for the body. So the cortex produces 3 hormones. Your glucocorticoid hormones, cortisol, maintains sugar. It decreases your immune response and helps the body respond to stress. And then there's the mineralocorticoid hormones such as aldosterone, and that regulates your sodium. So that's why whenever you have high blood pressure, you have to limit your sodium, and sometimes you have to watch out for your fluid intake because your adrenal glands and your kidneys work together. And the aldosterone also regulates your water and potassium balance. And if you're a heart patient, everybody knows that if your potassium is high or low, it can be all messed up. Even your sodium can be all messed up. Your androgens and your estrogens are also on the cortex of your the adrenal gland. So Addison's disease results from damage to the adrenal cortex. That's the adrenal gland. And the damage causes the cortex to produce hormone levels that are too low. So it's not the same as, it'd be like saying if you have hypothyroidism or hyper, same thing with this gland. So some of the, so the damage can be caused by your immune system attacking your adrenal gland. And tuberculosis, HIV, and fungal infections can trigger that. You could also have hemorrhage into the adrenal glands and tumors. So for the hemorrhaging, I would say if you had a traumatic event, like you get kicked by a horse on your kidneys, which my grandfather did. And when he was a kid, and he went his whole life with one kidney. And it's no big deal because you could live with one kidney. And when he got older, before he died, the bad kidney all of a sudden starts working and this good one crapped to bed. So some risk factors of autoimmune type of Addison's, swelling of the thyroid that often results in reduced thyroid function. Thyroid gland produces too much thyroid hormone, which is the overactive thyroid, which also causes Graves' disease. And I'll go over the Graves' disease in a little bit. You could get an itchy rash with bumps and blisters. The parathyroid glands that's in your neck, because you have 4 sets of glands. I had to count, sorry. So the parathyroid glands don't produce enough parathyroid hormone, and that's what you call hypothyroidism, or hypoparathyroidism. Sorry, my bad. And your pituitary gland does not produce normal amounts of some or all of its hormones, which is called hypopituitarism. Sorry for the big words, guys. They just couldn't make smaller words for medical field for some reason. The autoimmune disorder that affects the nerves and the muscles they control is myasthenia gravis. And the body doesn't have enough healthy red blood cells. That's your pernicious anemia. And testicles cannot produce sperm or male hormones, and that's testicular failure. And also type 1 diabetes, and you can end up with vitiligo. I don't know if you guys know what vitiligo is, where you lose the pigmentation in your skin. So, okay. Any questions or anything about Addison's?
No, it sounds scary.
Yeah, it can be, because anything that affects your adrenal glands and your kidneys, it can be, because if your kidneys aren't working, you end up on dialysis. You end up with high blood pressure. You could have a stroke. I mean, it's just one of those things. It's a snowball effect. If you don't, that's why I say it's really important to pay attention to whatever symptoms you have, because everything in your body works together. It's like an automobile. And believe it or not, the body is just like an automobile. If you don't have gas to run your vehicle, you don't go anywhere. For the human body, if you don't take in food and water, you don't go anywhere. So, I mean, it's about the same thing. So, the next one's celiac. It's called a celiac disease sprue. Now, for this one sucks. I have it. It sucks big time. But there is a difference between celiac disease and gluten sensitivity. Celiac disease doesn't go away, or it can, but it takes years, because you have to purge your body of gluten, barley, rye, and believe it or not, they put gluten as a filler in makeup, medicine, and other foods. So it's not just, and spices and everything else. So it's not just wheat, barley, and rye. You have to, if you actually have celiac, you have to go through your house, and they have a celiac checker, and you just download the app on your phone. It doesn't matter if it's an iPhone or an Android. You download the app, and you can either scan the barcode or just type it in, and it'll tell you if there's gluten or anything like that in the product. Gluten sensitivity just means you can get upset stomach, a little bloating, you can get diarrhea, and basically with that, you just, I know, don't even start. There's not enough, I'm sorry, but there's not enough medicine in the world that can, I'm telling you, when you get on those days of just constant diarrhea, they put you on loperamide or the over-the-counter brand, but to stop it. But ever since Dr. Phil told me, he was telling me all that stuff to take, like the probiotics and everything else, that's helped me a lot, actually. So, but so when you eat foods with gluten, like I said, the immune system reacts by damaging the villi. It's in your intestine, and just think about it as little fingers in your intestine, okay? And that's what moves your food along once it gets out of your stomach and stuff. So it moves it along. But with celiac, it damages those, and they can be, your intestines can become flat. And that's what's happened to mine in like 3 or 4 different places in my intestine. And so your food will sit there. And that's when you get the bloating and you get the toxins that build up in your body, and it sucks. So, and that's what also helps absorb the nutrients. And a lot of people who have celiac suffer from malabsorption. When I detox my body off of all gluten products, that when I very first found out, that first week, because your body's used to getting the carbs, the pastas, not carbs, the pasta, bread, and all of that, and you actually become really lethargic, or at least I did. And for about a week, I was like, I was sick, but my body's purging itself of all the crap. And our bodies are not, actually, they're not meant to eat wheat. It's too harsh on our body. And it's just, I guess it's cheap, whatever. But there's good news. They do make gluten-free products if you're a millionaire and you can afford to buy most of them. But for the most part, they do make gluten-free products. And like a lot of, like Cheerios is now gluten-free. So it's not the end of the world. So you do need to read your cereal boxes and stuff. Celiac can happen at any point in your life. A lot of people get it when they're a toddler, a young child, a teenager. But for myself, I was 45 years old when I got it. And apparently, if you're lactose intolerant, it can actually, and if you don't take care of it, you can actually develop celiac later on in your life. And I've been lactose intolerant my whole entire life. My mom is, my brother is, my oldest child is. There's quite a few people in my family that's lactose intolerant. So, and also, if you have someone in your family with celiac, they have a greater risk of getting it down the line. And there's really no, there's no cure. There really is no medication, except they do give you Zofran. Most doctors either Zofran or Phenergan, but they don't like giving Phenergan long term, or Compazine. They just don't. And I've been on Zofran now for almost 5 years, because I've been struggling with all the other issues that they thought I had. So most people with celiac are more prone to rheumatoid arthritis, lupus, the Sjogren syndrome. I hope I'm pronouncing that. It's Sjogren, and it's looks like it's Swedish, but Addison's, Down syndrome, intestinal cancer, intestinal lymphomas, lactose intolerant, thyroid disease, and diabetes. So those people, I have to watch out for all of that BS. So the dermatomyositis. Dang, I'll spit it out sooner or later. It's a muscle disease that involves inflammation and a skin rash, and it also involves muscle weakness, swelling, tenderness, and tissue damage, but no skin rash. So, it's I can't pronounce these damn words today. Polymyositis. So both are a part of a larger group of disease called inflammatory myopathy. So they don't know what causes it, like usual. But usually someone might have got a viral infection of the muscles or a problem with their immune system. So they also say that it may happen to people who have cancer in the abdomen, lung, or other body parts. Well, that one's shortened to the point. Graves' disease. So Graves' disease, it leads to an overactive thyroid, hyperthyroidism, and that's when the immune system mistakenly attacks the healthy tissue. So the thyroid gland, it's an important organ of the endocrine system, and it's located in the front of the neck above where your collarbones meet. So it's like right there, like that little dip. If you could feel your collarbones and where it connects, it's right there. For guys, it'd be like right by your Adam's apple, and that's where your thyroids are. And that gland, it releases hormones called thyroxine and triiodithyronine, and that controls your body's metabolism. And unfortunately, if your thyroid is underactive, they usually high or low, they put you on medication. Synthroid or levothyroxine, any of those thyroid medications. But here's the problem. Someone with an overactive thyroid, they can eat, probably Lorna, and never gain weight. But mine is sluggish. It's not like low enough to go on medication. But for me, I smell Cheetos and I gain 10 pounds. So, but it regulates your mood, your weight, and your mental and physical energy levels. So there are actually products like cinnamon, help speed up your metabolism. B12, your B vitamins help increase your metabolism and kind of, sometimes it kickstarts it, but it depends on your body. So, let's see, Graves' disease is the most common cause of hyperthyroidism, which is too fast. And it's due to an abnormal immune system response that causes the gland to produce too much your thyroid hormone. And it's the most common with women over 20. So, but it can happen like anything else at any point in time in your life that your body wants to fall apart. Now, Hashimoto disease is when your thyroid is underproductive. So my mom has the hypothyroidism, and they're worried she might end up with Hashimoto's. And hers is it fluctuates. Her hormone level, the thyroid it goes up and down, up and down. So she's been battling it for a long time. And So Hashimoto is a common thyroid gland disorder. It can happen at any age, normally in most middle-aged women, and the disease begins slowly. It can take months or years for the condition to be detected and for thyroid levels to become lower than normal. So Hashimoto disease is the most common with people who have thyroid disease. So in rare cases, the disease may be related to other hormone problems that's caused by the immune system. So if you have poor adrenal function and type 1 diabetes, then it's called type 2 polyglandular autoimmune syndrome, or PGA2. So Hashimoto's is rarely in children. So poor function of the adrenal glands can cause it, fungal infections of the mouth and nails, and an underactive parathyroid gland. Any questions so far, guys, or callers, or anybody?
I would probably gain weight if I ate like a normal person.
Well, yeah, but see, do you eat whatever you want?
Yeah, but I don't eat crap.
And you don't gain weight?
No,
No,
I don't
what I'm
eat
saying
chips.
is...
Yeah, I don't eat chips.
I know.
I don't eat McDonald's.
It doesn't matter.
Do fast food.
No, it doesn't matter. You can eat healthy food and still gain weight or lose weight. You just... See, one, you work, right?
Oh, yeah.
Okay.
24/7,
so,
even in my sleep.
Yeah, I know. See, here's the thing. You may not have an overactive thyroid, but your metabolism may be faster. Mine's molasses, and yours is like running water. That's how I would compare ours. So, myself, I have to watch what I eat.
I'll tell you something, Matt. It can be 100 degrees out, and I'll just get done eating, and bam, I've got goosebumps. I'm freezing.
Well, one, that's probably your size if you don't have much body fat.
No.
I'd actually talk to your doctor about that one. I mean, it could be something simple. You could be anemic. Usually people, I'm going to go over the anemia, but...
I figured it because my metabolism is on overdrive.
Yeah, and that's what I'm saying. When people you're low iron, they get cold all the time. You're always cold. So, I mean, that's because your iron's low. So that's why I said eat green leafy vegetables with that. You can eat chicken liver, beef liver, and that'll help bring you, or take iron pills, vitamins. I mean, that's the best way to do it. But for myself, like my pancreas, I'm not a diabetic, but I don't know if this is what it's actually called. It's like an insulin dump. I can eat, and my body will produce a lot of insulin and to get rid of the sugar. And then I feel like crap. So it doesn't matter what I eat. It could be hell, I eat and when my sugar's really low, I get all that jitters and stuff. And like I'll eat a banana and peanut butter wrap to bring it up. It's complex carb and all that cool stuff. But I could still feel like crap and be really tired because my body's like, oh, sugar, and dumps insulin. So your thyroid is doing the same thing. So, and have you ever had your thyroids checked?
No.
Oh, okay. Well, I mean, unless you're like thin as a rail and skin and bones, it's not the end of the world. But it doesn't always necessarily mean it's your thyroid. You could have just a fast metabolism.
I definitely don't look anorexic.
So the next one is MS, or multiple sclerosis. And this disease attacks the brain and spinal cord, your central nervous system. So what it is your nerves have a little. Think of your cable cords, right, for TV and stuff. The outer covering is the myelin sheath. That's what it covers the inside, and that's the axon is the actual nerve that's inside, and so the outer covering is what gets damaged. So MS affects more women than men, and most people get diagnosed between 20 and 40, but like everything else, you can get it at any age. So, I can't see, sorry. So like I said, it covers the myelin sheath, the outer covering of your nerve, and that protects it. You know, all your nerves that go up and down from your brain all the way down to your toes. And you know when you get cut anywhere in your body, like we were talking about the burns, when someone has third-degree burns, how it damages the nerves, you can actually damage just the outer part of your nerves and cause problems.
I know. My thumb is still numb. My thumb is still numb, and I almost cut my thumb off.
So I did post this website on the national page, so you guys can look it up and see what I'm talking about, the myelin sheath. And when you go down on the first part of the page, then it has all of the top 10 or 15 autoimmune. It's blue. Just highlight each one and go down for MS, and you can see the diagram. It's kind of hard to explain it on the radio. So the nerve damage is caused by inflammation. So same thing, your immune cells attack the nervous system. It can attack any area of the brain, the optic nerve, and the spinal cord. So have you ever had a concussion or hit the back of your head?
I'm not sure, but I know I gave myself a black eye with when I was in my first car accident. And my second car accident, I took out the side window and the roof came down on me. I'm pretty sure I did have
your occipital lobe to your brain is on the very back of your head, on that little hump right there. And then your brain stem goes right down. That's what goes right through at the top of your cervical collar. Well, see, when I got my car accident, my head hit the steering wheel, and then it went back as I was on a truck, and it hit the back and smacked it, and it affected my eyesight for a little while. I had blurred vision really bad and migraines because I bruised the occipital lobe of my brain.
I don't know.
So that's.
I don't know.
Huh?
I don't know what I hit. I knocked myself out. I didn't wake up till 3 hours later in the cities.
That's common. It's common when you hit your head because you bruised part of your brain, and the swelling pressed on whatever part of the brain that got hit or the nerve. I passed out maybe 30 seconds to a minute, and the next thing I knew, I'm hanging off the side of a cliff. So with my truck. So it doesn't matter. So anything can damage your brain. It doesn't matter what it is. So, of course, they don't know what causes MS, like usual. That's why it's called practicing medicine, by the way, because you practice. That's exactly why they call it that. But they say usually what causes it is a virus, a gene defect, or maybe even both. So, and environmental factors may play a role in it. So, yet again, they don't know. So you're more at risk if someone in your family has it, or if you're in a part of the world where MS is more common, which they don't say that. So some of the symptoms vary because of the location, the severity of the attack can be different. The attack can last for days, weeks, or months, and then it goes in remission. So, and you can have periods of reduced symptoms or no symptoms. You can have a fever can trigger it, a hot bath or a hot shower. I cannot stand scalding hot. I mean, not scalding hot, but if my shower is too hot, I actually get dizzy. So people with MS should not take hot baths. Too much sun or stress can trigger it or worsen it. Stress is not good for your body anyway. So if you can get rid of stress, you're gold. So it's common for the disease to relapse. So, and it can also get worse without remission. So it's one of those little funny things. So some of the symptoms is loss of balance. And this is why I say, if you go on WebMD or some of these other medical sites, if you look like this one, loss of balance, muscle spasm, numbness or abdominal sensation, problems moving your arms or legs, problems walking, problems with coordination and small muscle movements, a tremor or weakness in one or more arms. Well, here's the thing. Parkinson's gives you the shakes, the weakness. So, I mean, or you could have a cramp. You could have low potassium. I mean, it's just, that's why I say be very careful when you go through and look at like the symptom checkers. Just be careful when you do that. You could have bowel and bladder problems. You could have constipation and stool leakage. You could have problems when you begin to urinate, frequent need to urinate, a strong urge to urinate, and urine leakage. So basically it mimics the same symptoms of a kidney infection or a bladder infection or a UTI. You can have double vision, eye discomfort, uncontrollable eye movements, and vision loss. Usually it's just one eye or the other one. You can have facial pain, painful muscle spasms, tingling, crawling, or burning feeling in the arms and legs. And some other brain and nerve symptoms is a decreased attention span, poor judgment, and memory loss. Difficulty reasoning and solving problems, depression, feelings of sadness, dizziness, and hearing loss. Problems with erections for guys. And women could have problems with vaginal lubrication. And for speech, you can have slurred or difficult to understand their speech, trouble chewing and swallowing. And fatigue is common and bothersome as the MS progresses, and it's usually worse in the late afternoon. That's because you're up and moving around a lot. And so, let's see what else. So an exam of the nervous system may show reduced nerve function in one area of your body. And you can also have the reduced nerve function, and it could spread over a lot of your body. You can have abnormal nerve reflexes, decreased ability to move a part of the body, decreased or abnormal sensation, other loss of nervous system functions, such as your vision. So that's pretty much it on, hold on a second. Well, this one has treatment. Yeah. So they do have medications you can take, and they're often long-term, and usually they're supposed to help slow the disease. Steroids decrease the severity of the attacks. You can have medications for muscle spasms, urinary problems, fatigue, and mood problems. And a lot of times people will have physical therapy, speech therapy, occupational therapy, and support groups. And the farther your disease progresses, you might need wheelchairs, bed lifts, shower chairs, walkers, and things like that. And that you need good nutrition and enough rest and relaxation to help out. Whew. You guys still with me, or are you sleeping? I'll take napping for 100, Bob.
Chipping in, I'm still here and awake.
Huh?
Yeah, there's a first.
So myasthenia gravis is a neuromuscular disorder.
Say that
And
fast 3
it
times.
involves the muscles and nerves that control them. They believe it's a type of autoimmune disorder, and like I say, it attacks your healthy tissue. And antibodies are proteins made by the body's immune system when it detects harmful substances. I'm trying to find out where. Let's see. Where's it at? Okay, so they believe some, not all, some cases of myasthenia gravis is linked to tumors of the thymus, an organ of the immune system. It can attack at any age. More young women have it than older men, and older men. And it's weakness of voluntary muscles. So these are the muscles that you control. Autonomic muscles of the heart and digestive tract are not usually affected by this at all. And so the muscle weakness of myasthenia gravis gets worse with activity and improves with rest. A lot of times, most of your illnesses do improve with rest. So this muscle weakness can be led to a variety of symptoms. Breathing difficulty because of the weakness of the chest wall muscles. Chewing or swallowing difficulty, and so they have frequent gagging or choking or drooling. You have difficulty climbing stairs, picking things up, or from a sitting to standing. Difficulty talking, drooping head and eyelids, facial paralysis or weakness, kind of like Bell's palsy, kind of where it droops, fatigue, hoarseness, double vision, or difficulty maintaining a steady gaze. Okay, so let's see here. The doctor will perform an exam, and it'll show if you have muscle weakness with eye muscles, and that's usually the first issue is with your eye muscles and your normal reflexes and feelings. So your acetylcholine receptor antibodies are associated, and let me let you know what that is. Some people call it acetylcholine, acetylcholine, tomato. I don't care. Wherever you're from, that's how you pronounce it. And it's a protein found in the blood that's with anyone who has it. So if it shows up, chances are that's what you have. So it's just like drawing blood, like a regular blood test. Oh, crap. I lost my place. Sorry, guys. They can do a CT or an MRI. Nerve conduction studies, they suck. Only 3% of people who have a nerve conduction test will vomit and pass out. And guess what? I am one of those 3%. I don't know if you guys have ever had one. When they check your your ulnar nerve, it's sort of like acupuncture, except there's wires connected to it, and they shock you. It sucks. An EMG, an electromyography, and that checks the muscles and the nerves that control the muscles. Pulmonary function test, that's when they stick you in this little plastic tube. If you're claustrophobic, it's hard. It's see-through plastic, but it's still hard, and you blow in the little tube. Let's see. No. So the treatment pretty much is if you get double vision, put an eye patch on, rest throughout the day, avoiding stress and heat exposure, because that usually makes it worse. And some of the medications they usually give is prednisone or neostigmine. So, and then people, when you get to a certain point, if you're sick, you may need to be put on a ventilator because of the breathing problems. So, you guys can make noise at any time. I promise. No. I know, but you guys are so damn quiet. You can interject every now and then. I have to keep tapping my phone like, okay, am I still on?
That's because Bobby made
there's not even
mute.
Static. Huh?
That's because Bobby makes us put it on mute when we're not talking.
Oh,
no,
well,
I don't.
Shit.
Do too?
Well, yeah, if there's a lot, I would say put it on mute if there's a bunch of people. If it's just like 2 or 3 people, there's no need in putting it on mute. Unless you're outside and your dogs are barking. But my little turds are sleeping. Well.
But I never hold still, so I'm always making noise.
Oh, okay. So pernicious anemia, it's when your body doesn't have enough healthy red blood cells. And the healthy red blood cells provide oxygen to the body tissues. And there's a bunch of different types of anemia. So, pernicious anemia is a decrease in blood cells that's in your intestines that can't properly absorb vitamin B12. So, and you, I don't know if they make, they do make B12 shots. Yeah, they usually do it for alcoholics. You get B12 shots. But because if you get a shot of it, it doesn't go into your intestines. So your intestines is where the problem lies. So, but where you get B12 is meat, poultry, shellfish, eggs, and dairy products. And a special protein called intrinsic factor, IF, it binds to vitamin B12, so it can be absorbed in the intestines. Remember what Dr. Phil said about the vitamin D in eating? So it'll go to where it needs to go. Same thing with the B12. So the protein's released in the cells or by the cells in the stomach when the stomach doesn't make enough intrinsic factor, and so your body can't absorb the B12. So some common causes is weakened stomach lining or atrophic gastritis. It's an autoimmune condition which the body, we know it attacks. We already get that part. But it attacks the intrinsic factor protein in your stomach. So in rare cases, it could actually be passed down through the family, and that's called congenital pernicious anemia. And a lot of some babies do get it. So, but that they usually can tell that when they're born, I would hope. So the people that are most likely to develop it is if you're Scandinavian or Northern European or have a family history of it. And so certain diseases can also raise your risk. Also raise your risk for Addison's, Graves', hypoparathyroidism, and hypothyroidism, myasthenia gravis, loss of normal function of ovaries before 40, and that's called primary ovarian failure. Type 1 diabetics, testicular dysfunction, vitiligo, Hashimoto, and celiac. So pretty much all of these can cause any of the other illnesses. Reactive arthritis does not sound very fun. Usually this type of arthritis follows an infection and may also cause inflammation of the eyes, the skin, the urinary and genital systems. So they don't know what causes this one. However, it usually follows an infection, but the joint itself is not infected. So reactive arthritis occurs most often in men younger than 4. Well, that would be boys younger than 4, not men. Sometimes it affects women. If you have an infection of your urethra, which is where your urine goes, where you pee out of, after unprotected sex, the most common bacteria that causes it is chlamydia. So don't ever get it. And it can also follow a gastrointestinal infection, such as food poisoning. Wow. Up to one half of the people. So pretty much half of America or half of the world has this and don't even know it. And so it's possible that such cases are a form of spondyloarthritis. And that's what I have. My spine's twisted. And that's why I have about the lower part of my spine when I fell off the tower in the Army, and that made it worse. And I was actually born with it, and nobody ever picked it up. And I had no idea until I was 42 years old. The disorder's rare in young children, but you could get it as a teenager. If the children get it, it's between 6 and 14, or after they've had C. diff. So you guys know what C. diff is? I'm pretty sure you do. The diarrhea bug.
Oh, yeah.
Yeah, okay. It smells like rancid chicken or something worse. Yeah. When infants
like
get it,
Lorna?
or small children, yeah. They could get what I call projectile diarrhea. And you can't, it's awful. It is awful. When I was raising my other granddaughter, the first one I was raising, she got it twice. And we went swimming in the river. And so her doctor thought she got it from that. But we don't know how she got it. That child had diarrhea so bad, and it smelled so bad, she cleared the whole entire floor at the hospital. The housekeeping had to come and spray the hallways with air freshener because it was that bad. So it's unmistakable smell. It's awful. And it's highly contagious, too, by the way. I don't know if you guys knew that. So urinary symptoms will appear within days or weeks of an infection. So you can get burning when you urinate, like fire. You could have leaky urine, problems starting or continuing a stream of urine, and having to pee like every 5 minutes. You know, you feel like you got to pee and you can't go. So a low fever along with eye discharge, burning or redness, pink eye, can develop over the next several weeks. So if you have an infection in your intestines, the diarrhea may be bloody, and it will be red, simply because you're irritating the intestines from the chronic diarrhea. So you can have joint pain and stiffness during that time period. So the arthritis may be mild or severe, like heel pain, pain in your Achilles tendon, pain in the hip, knee, ankle, and low back, and pain and swelling that affects more than one joint. So some of the tests that they can do is the HLA-B27 antigen, a joint X-ray, blood test to rule out rheumatoid arthritis, which is painful, gout, which is painful, or lupus. They'll do an erythrocyte sedimentation rate, or it's called an ESR. They'll do a urinalysis, a blood culture. They'll check you for chlamydia, or they'll take fluid out of a swollen joint. And by the way, most of that is rather unpleasant. So basically, the goal is to find out what's causing it and to treat it. So eye problems and skin sores don't need to be treated. Most of the time, they just go away on their own. So unless your eye problem is your eye swollen shut and can't, it doesn't go down, you lose your vision and don't come back. I mean, things like that. So you could take NSAIDs, which is like a leaf. You can also take corticosteroid. That injection, they get you right in the joint. They're not fun, but they usually last about 30 days, depending on which one they use. So if the arthritis continues, in spite of using like a leaf or whatever, or methotrexate is a new drug for, well, that's not new, but it's newer, and they can use that if nothing else is helping. So they also can give Enbrel. I'm sure you guys have heard on the radio, Enbrel, Humira, and they use that to suppress the immune system. So those are really popular. That's it for reactive arthritis. Okay, rheumatoid arthritis. I'm sure everyone's probably heard of rheumatoid arthritis, and that's usually it's a long-term disease, but it's the joints around the surrounding tissues. A lot of times it's in your hands, your knees, and your feet. But the two biggest places that I've usually seen is your knee, and the knee will look really huge. And then that's when the fingers can be misshapen from the arthritis. So, and they don't know what causes it. Pretty much nothing. They know what causes any of it. It could come up at any age. Usually more common in middle age. More women get it. Infections, genes, and hormone changes, they believe is linked to it. And also smoking. It's less common than osteoarthritis, which is something that happens in a lot of people due to wear and tear in your joints. I'm pretty sure that every veteran ends up with osteoarthritis and the longer you serve, because of the constant ruck marches and the running and the heavy things you carry, and the more that you use, especially your knees. But we know the VA. Most of the time it affects both the joints on both sides of the body: fingers, wrists, knees, elbows, ankles, hips, and shoulders. So usually it's both sides, not just one. Usually it starts out slow. A lot of times you get minor joint pain, stiffness, and fatigue. So you can also have stiffness that lasts more than an hour. The joints will feel warm and tender and stiff when not used. That's why it's important. If you know you get it, if you find it early enough, a lot of times they do physical therapy on the hands. They give you those. It's a brace that goes. It's kind of like, I'm trying to think. It's a firm brace. It goes underneath your hand, and then just like the Velcro straps that goes around it, and that's to keep your fingers from getting misshapen. I can't even think right now. The joints are often swollen, and so over time, they may lose their range of motion. And that's why I say it's important to move them. You can either do passive range of motion or active. If someone else does it for you, it's passive range of motion. And if you could do it yourself, that's active range of motion. Sometimes you can get pleurisy, and that's when it's chest pain when you take a deep breath. You can get dry eyes and mouth, eye burning, itching, and discharge of your eyes. You can get nodules under the skin, and that's a more severe sign of the disease. Numbness and tingling and burning of the hands and feet, problems sleeping, and usually they diagnose you with RA when you have pain and swelling in 3 or more joints for longer than 6 weeks. They'll also do, you also have to have a positive test for rheumatoid factor or anti-CCP antibody. You can have an elevated ESR, and then they have to rule out all the other types of arthritis as well. And so they could do a CBC or a complete blood count, check your metabolic panel and uric acid, and that's also for gout as well. Check you for hepatitis, MRI, joint fluid analysis, which those are fun. And sometimes you might need surgery. So, and then they might put you on anti-inflammatory. I lost it, sorry. Anti-inflammatory medications. Aspirin, Aleve, ibuprofen, naproxen, Selexahib. I can't pronounce that, sorry. That usually works well with inflammation. So, sometimes they might use methotrexate. So a lot of times that does help. And anti-malarial medications, hydroxychloroquine. Who knew? Plus years. And they think it, kills people, but it doesn't. So, and that's it for rheumatoid arthritis. You guys still with me? Yes, no?
Here.
So? Okay.
I'm here.
Okay. Any comments,
I don't know if
questions, concerns? I just like to know I'm not the only one here that's participating. It's like take a break. Your brain can only absorb as much as your butt can stand. At least that's what my teachers used to tell me. So this Scandinavian disease, I think it's Scandinavian, but I don't know how you pronounce it. It looks like Sjogren, but it's SJO, the 2 little dots over the O. So I have no idea how to pronounce it. But anywho, this affects your glands that produce your tears and your saliva. They're destroyed. Pretty much, it feels like cotton mouth and dry eyes, extremely dry eyes. And this one can affect your kidneys and your lungs. So, pretty much it occurs more often in women. You know what, Lorna? I think it just sucks to get old for women. I'm telling you, everything hits you when you're 40.
Absolutely.
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 I know, and here's the other thing. Growing old ain't for bitches. Plain and simple.
Lorna.
What?
No, seriously. Have you ever heard any young people complain about this, that, and the other? Now, military don't count. Military doesn't count because we know what that goes through. But on average, when you hear a young person complain, I just want to go walk up to them and slap them and say, yeah, wait till your body starts falling apart, because growing old ain't for bitches. I'm telling you, some of the toughest SOBs are old. And what happens is your body, you get, well, not everybody, but you get used to it. Someone with high blood pressure. I was getting used to my blood pressure being high, and it didn't bother me anymore. And that's not good, because you've acclimated to it. Like acclimating to hot weather when you're always in a cold climate. It's like, Lorna, if you were to move to South Texas or South Florida, it would take you a while to acclimate from cold temps to the humid. It just like it hits you like a brick wall when you walk outside of your house.
I know. When I was seeing my brothers in Tennessee, I did not like that one bit.
Why?
Because you'd be sitting in the shade, not even moving, and you're sweating your ass off.
Yeah, and there's different types of heat: dry heat, humid heat. There's the windy kind. You know, people are like,
and those cicadas, they don't ever shut up.
Here's the thing. Okay, there's the dry heat. I would rather have dry heat than humid heat. You know why? Because humid heat, it's like you open your door and you walk outside, and for like women, your hair could be all done up, nice and pretty, and you walk outside, and it just falls because of the humidity. Your glasses get fogged up. It's like going into your car where it's 150 degrees. You know, it could be anywhere, and you open the door and your glasses fog up. Same thing. That's what humid heat does. And you don't even have to move, and you're sweating like a pig. I mean, it's like I cough. Oh, my God, I'm soaking wet. So, and dry heat's not like that at all. But I can't remember which one it is for COPD patients. I can't remember if it was dry heat or humid heat. I can't remember. I'll have to look it up. So, anywho, secondary Shogun. I'm gonna call it Shogun because I can't pronounce. So Shogun syndrome. You can also get rheumatoid arthritis, lupus, scleroderma, polymyositis, Hep C, and IgG4 disease. So, yeah, pretty much any autoimmune disease or disorder, you could get a bunch of them. So your eye symptoms, itchy eyes, always feeling like there's something in your eye, besides your finger when you rub your eye. You could have difficulty swallowing or eating dry foods, loss of sense of taste, problems speaking, thick or stringy saliva, mouth sores or pain, tooth decay and gum inflammation, hoarseness. You can also be fatigued, have a fever. I'm sure. Have you heard of Raynaud phenomenon with your fingers and your feet? A lot of times they turn blue. Like if you're in the extreme cold, but your feet will turn blue and it may not even be cold out. You could have joint pain or swelling, swollen glands, skin rash, numbness and pain due to neuropathy. Diabetics will know about the neuropathy, like in your feet and stuff. Cough and shortness of breath due to lung disease, irregular heartbeat, nausea and heartburn, painful urination, blah, blah, blah. Sorry. And there's a bunch of tests. They'll check your blood chemistry, check your liver enzymes. They'll do a complete blood count with differential, a urinalysis, your peanut cup. I mean, there's just a whole list of tests that they can do. So a lot of times with this, you can use the artificial tears. What the hell is that? I forget what it's called. Visine or anything like that. Cyclosporin liquid. Yeah, all kinds of. It says sip water throughout the day, chew sugarless gum, and if you can, try to avoid antihistamines like Benadryl because it dries you out. So, and go to your dentist. All righty, we got 2 more. Woohoo! Hey, lupus. Woohoo! Let's see. So lupus attacks the skin, joints, kidneys, brains, and other organs. Wow. So it could be genetic, environmental, hormonal, and certain medications can cause lupus. My the lady I do group therapy with at the VA, she has lupus, and when they thought originally, I think I had COVID twice. Back, was it February? Me and Pat were both really sick, and I had an appointment to go see her, and they didn't give me a mask. I said, look, I don't even have a fever. I don't even have a cough. It's just sinuses and this, that, and the other. But anyone with lupus, any autoimmune disorder, has to be very careful with COVID. But she was mad, and she has not gone to the VA ever since we went to the virtual meetings. You know what I'm talking about. Have you done those yet, Bobby? The telemedicine?
What, on the live chat?
Yeah. Okay. Yeah. So she's been doing that since last March to avoid. I mean, she does it at home. So she does all of her appointments at home, group appointments. She does so because she's got lupus, so she has to watch out for being sick.
Right.
So it's, you know what? I swear, everything attacks women more than men. Nearly 10 to 1.
Oh yeah.
At any age.
I bet.
It appears most often in young women between 15 and 44. Geez, that's half your damn life. More people of color, Asians, the Caribbeans, and Hispanic get it. But Caucasians can get it. They think my mom has it, or she had a false positive for lupus, so they got to test her again. I think it's once they have to wait a year. I guess, I don't know, whatever it was. But it can come and go. Everyone with lupus has joint pain, and some develop arthritis. But you can have chest pain when taking a deep breath. Kind of like if you're sick and you have pneumonia and your lungs are filled up with fluid, it's hard to take that deep breath. So it's kind of like that. Of course, fatigue, fever with no other cause. You could be healthy and all of a sudden get a fever and there's no reason. Like some people can have an abscess in their tooth and end up with a fever. It doesn't matter. General discomfort. Uneasiness or just bleh, that kind of, you just feel like there's something wrong. You can have hair loss, weight loss, mouth sores, sensitive to light, and the butterfly rash, and that's on your cheeks. I'm sure you've probably seen someone, and it looks exactly like butterfly wings on their cheeks. One wing on one side of the face and one on the other one. And that's what happened to my mom. And this is why they thought she had lupus, because she spent a whole summer and she couldn't go outside much, or in the sunlight, I should say. And she had the skin rash on the cheeks and the bridge of the nose. So, so if you have that, I'd go get checked or bring it up to your doctor. And you could have swollen lymph nodes. So, other symptoms depends on which part of the body is affected. Your brain and nervous system. You could have headaches, weakness, numbness, tingling, seizures, vision problems, memory, and personality changes. You could have abdominal pain, nausea and vomiting. You can have valve problems in your heart, inflammation of the heart muscle. You could end up with a buildup of fluid in the pleural space, which is pleurisy. Sores in your mouth. You could have swelling in your legs from your kidneys. If you have some people like congestive heart failure, it's not the same thing. It's like congestive heart failure, would your ankles swell? Same thing for this one. You could end up with clots in your veins or arteries, inflammation of your blood vessels, constriction of your blood vessels. You could have anemia, low white blood cell, or platelet count. So let's see what it says. Test to check for lupus is the blood test is called ANA, anti-nuclear antibody. They'll do a CBC, which is a complete blood count with differential. I forgot what the differential was. Never took blood, so I forgot about it. Chest X-rays, your serum creatinine, a urinalysis. Let's see. Yeah, and there's a whole bunch of other tests. Sorry. There's no cure for it, and basically it's to control your symptoms. And severe symptoms will affect your heart, lungs, kidneys, and other organs. So basically they got to find out how active the disease is, what part of the body is being affected, and what form of treatment is needed. So your Aleve, your aspirin, and stuff like that for joint pains and pleurisy, but always talk to your doctor first. Low doses like prednisone. Also, if you're put on prednisone for a long period of time, you could get that moon face. But it goes away. Stop taking it. Corticosteroid creams, like I want to say Preparation H, but that's not what it is. You know what I'm talking about, Bobby or Lorna. What's it called? The brand name of the corticosteroids. Hydrocortisone.
Yeah, I was just going to say that.
I couldn't think. I could see the red white tube. I'm like, okay, what's it called? Plaquenil. So the hydroxychloroquine. And lupus patients take that, and they've been doing it for 55 years. And if it was a dangerous drug, they would not be giving it. You know, but it's also to treat malaria. So they also may give methotrexate, and that's used to reduce the dose of the steroids. And so for the more severe lupus, the high doses of steroids, they may even give immunosuppressive medications. And half of these I can't even pronounce, so I'm not even going to bother. But a lot of those are highly toxic, so they need to check your blood and all of that. And also they may put you on blood thinners like Coumadin. So, but if you have lupus, wear protective clothing, sunglasses, and sunscreen, like SPF 500. Get preventative heart care. Keep your immunizations. I'm pretty sure you have to get your flu shot, your pneumonia shot. Everyone has to get a tetanus shot. And have screenings for osteoporosis. And don't drink alcohol, or just drink minimal amounts, and try not to smoke. And apparently smoking and drinking causes a lot of problems. And so type 1 diabetes, it's a lifelong chronic disease where your sugar is high. So, of course, it can happen at any age. I'm trying to think what it's called. But, childhood diabetes. And then you also have for older adults. And that's for people who don't give a crap what they eat. They eat whatever they want. So it can actually cause you to have diabetes. And sometimes you can control it with diet. And sometimes you can't. And then you go to the pills like metformin, glucophage, and all that good stuff. And then if you need more than that, then they have the insulin. So, and it's a hormone that's produced in your pancreas, and that's below and behind it. It looks like an ear of corn if you look at it in a picture. I mean, that's the only way I could describe it if you want to know what it looks like. Insulin is needed to move the glucose into your cells. So, and the glucose is used for energy later on. So, people with type 1 diabetes, they either produce very little insulin or none at all. I don't think I've ever heard of anyone with a pancreas transplant, ever. I'm not saying that you can't, but I've never actually heard of it because I've always wondered why they just don't, do a transplant. So if you have too much insulin, they could go into DKA or diabetic ketoacidosis. And if you've ever been around anybody that's a diabetic and you smell Fruity Pebbles, because that's exactly what it smells like. It's like sugary, sweet breath. Or their urine can smell like that. Their sugar is high. I'm talking probably 500, 600, 700. You can go into a coma with DKA. So if you're a diabetic, please don't be hard-headed. Check your sugar when you need to and take your insulin or take your medicine or control your diet. Okay, because you can lose body parts like feet. You can lose up to your knees because of the neuropathy, and you can get sores, and so please check your, if you're a diabetic or whatever, or know anyone who is, have them check it. So if someone's a type 1 diabetic, or if their sugar is high, they may be very thirsty. Usually it's for water. And that's one of the reasons whenever it's happened to me, but my sugar just was up, and then all of a sudden it'll tank. But you can't get enough water. It's like they drink and drink and drink, and they can't ever satisfy that water thirst. You can feel really hungry. You're tired all the time. Blurred eyesight. You can have, and this is part of the neuropathy or beginning of it, the numbness or tingling in your feet. That's why diabetics have to wear either diabetic socks. It's to keep the blood flow going back up if you get a cut on your foot. You have to take care of it and pay attention. They make diabetic shoes. Losing weight despite an increased appetite, and urinating more often. So, let's see. So, like I said about the diabetic ketoacidosis, if you have that or go into that, you can have deep, rapid breathing, kind of like a dog panting, but deep breaths, fast. You could have a dry skin and mouth, flushed face, the fruity breath odor, nausea and vomiting. They could have a hard time. Hold on, my dog barking. They can't keep down fluids, and they can have stomach pain. So Now, just because someone's a diabetic, that doesn't mean their sugar can't drop. So if you're on insulin and you could actually take too much, and so it'll go below 70. I mean, if it's 65, it's not the end of the world. It really isn't, but it depends on you. When you start seeing that sugar go below 60, then you have problems. The lowest mine has ever been was 35. And you feel crappy. You could have a headache, have hunger, nervousness or irritability, rapid heartbeat, like palpitations, shaking, sweating, and weakness. Also blurred vision. That's one of the things that I got. So, you guys still with me? I know I ask this every couple of minutes or so, but it's nice to know I'm still on the air. Okay.
Bobby's napping.
I know Bobby's napping. He's napping in the corner. Acts like he's listening.
No, I'm not. I'm not, Lorna.
There's a quiz after every show from now on because I want to see who's paying attention. Okay, here's your question. What is Hawaii's fish called? I know both of you were on the show. See, it's the alcohol. That's why neither one of them can. That's why neither one can remember it.
Oh God, a test.
I am just kidding, guys. But now you're gonna think about it until you find it. It's like getting those annoying songs stuck in your head and you can't get them out. Like,
what's the answer?
It's a humu humu nuka nuka apua'a.
Yeah, okay.
Or better known as the triggerfish. I just think it's so cool to say it. Humu humu nuka nuka apua'a. And now I'm going to say it, even in my head. So anyway, you can to diagnose for diabetic, they do the fasting blood sugar. I don't know if you guys have ever done it. I'm sure you have, Lorna, when you had your kids. They make you drink that pound of sugar syrup.
Oh God, I used to be a Pepsi drinker, and after drinking that, I could never drink it ever again.
Yeah. Okay. See, and that's what they give you is that you want to gag. If you're lucky, you got the lemon lime. Because the other players, I'm like, nope, I ain't doing it. Nope. Same thing with the barium, the swallow with that charcoal crap. I'm like, nope. I want lemon lime. I do not want any other flavor. They're like, what? I'm like, I know you have it, and I want it cold. I will not drink it at room temperature. And they're like, wow, you're awful needy. I'm like, do you want the test or not? So, okay. Then they'll do random blood sugar tests. Usually it says if your sugar is over 126. But a lot of doctors don't even give insulin. It depends on the person. Because some people, I've tested their sugar, and it's like 175, and they're good. They don't get insulin until it's about 200 or 199. So it all depends on the doctor's sliding scale, and they'll do an A1C on them and see what their sugar is, and it's just a big mess. Oh, excuse me. Yeah, it says oral glucose tolerance test. That's the one where you drink the gallon of sugar, or at least that's what it feels like. And then they do the A1C. So let's see. They also do a ketone testing, and it's just checking your sugar. I mean, a blood sample or a urine sample. So you may have ketones in your urine, and I'm not going to get into all of the specifics because, whatever. So sometimes when they have pneumonia, a heart attack, or a stroke, when there's nausea and vomiting, and during pregnancy is when they'll do those. So let's see. Oh, yeah. So check the skin and bones. on your feet and legs, always. If your feet are getting numb, you could have diabetic nerve disease or neuropathy. Check your blood pressure. Have your A1C every 6 months checked. Check your cholesterol at least once a year. And visit your eye doctor, because diabetes you could also lose your eyesight with diabetes. Yeah, diabetes. I think that's about it. So if you're diabetic or know someone who is, recognize and treat how to treat low blood sugar, high blood sugar, how to plan meals, including your carbs, know how to give insulin, how to check the blood glucose and urine ketones, and how to adjust insulin. Because also when you exercise, and if you have low blood sugar, there's those little sugar wafers. I carry them because, one, anybody around you could be a diabetic. You know, there is one thing that they don't have on here is a brittle diabetic. Let me see real quick. I don't know if it does or not. No, it does not. I'm going to go over that, because brittle diabetics, actually, I think it's worse than having a type 1 diabetes, because diabetes. Okay. So a brittle diabetic, their sugar can skyrocket and then drop fast, and it will go below 70. And so it's really hard to control. It's a severe form of diabetes. It's unpredictable swings in blood sugar, and it can affect your quality of life, and you can end up in the hospital. I've met one person who was a brittle diabetic. So the risk factors for it is having type 1 diabetes, and it rarely happens in type 2 diabetics. So basically what happens, it's your blood sugar fluctuates between high and low, and it's like being on a roller coaster. 1 minute it could be 500, next minute it could be 50. So usually it affects women, hormonal imbalance, overweight, have hypothyroidism, you're in your 20s and 30s, if you have a high level of stress, depression, or celiac. But I'm not in my 30s, so I'm out of the picture. I'm having a brain fart right now. Don't mind me. So some of the symptoms is dizziness, weakness, irritability, extreme hunger. Probably like you could just eat, and then you're still starving. It's like you cannot get enough food. Trembling hands, kind of like if you have a panic attack, some people, their nerves, their hands will shake. That's exactly what it's like. Blurred vision, double vision, severe headaches, trouble sleeping. And so the symptoms of high blood sugar is weakness, increased thirst, urination, blurred vision, and dry skin. So, and sometimes they have to have the subcutaneous insulin pump to measure their insulin and to automatically give them the insulin they need, because you really can't use like the sliding scale, because you really can give them too much insulin, and it's like these insulin pumps know exactly how much they have to have. So, and the pump's attached to a narrow plastic tube that's connected to a needle, and it gets right under your skin. It's kind of like an IV. And they wear it constantly, 24 hours a day. So, and it has a continuous glucose monitoring. So, you often have to have it. and trying to think here. I'm trying to think of. I don't know those watches that tells you what your blood sugar is, because it's like it constantly monitors. It's something like that. They have that also to check. So I believe that is it. This says it's not fatal, but if you don't take care of it, it can be. Any illness can be fatal, no matter what it is. So, and you could go into a diabetic coma. Maintain a healthy weight. See a therapist to help manage your stress. Get general diabetes education, and go see an endocrinologist, and that's the person who does your endocrine system. And that is all. We are all done. Yay! If anybody's even there, you know, I'm talking to myself. Or am I still on?
Oh, we love to let you think that you were cut off.
I know you're an ass. That's all it is. You're a giant ass.
Stephanie made me do it.
Huh?
Stephanie made me do it.
Oh, bullshit. Stephanie did not make you do it.
I know, she's sitting here going, I didn't make you do shit. I'm sitting here minding my own business.
I just posted the brittle diabetes thing also. So everything is now posted.
Cool.
So, yeah, I mean, I think what I'm going to start doing, I thought about it today, I am still fighting on the radio, on the shows. If you would download it onto YouTube or however those last 9 shows got on there, I could put it on our YouTube channel.
Yeah.
Because I can't. I went on our Blog Talk channel, and it's telling me to sign up for it. I'm like, I don't want another damn channel. I just want to freaking download the damn videos. But what I think I might do.
On what?
On our YouTube channel.
Oh, on the YouTube? Yeah.
Yeah.
You should be able to put everything on one channel.
I know. I got our link, our Blog Talk link on the YouTube, but here's the thing. I don't know how to get the individual shows onto YouTube because we have 9 already on there. So I downloaded those. I put those on our YouTube. But I don't know how to get them from Blog Talk to YouTube. And it may be because it's in your name. So you may have to do it.
No, you might be. No, you could do it. When you click on the show, it gives you a share option. It gives you a share option, and then what happens is when you click on that share, it pops up Facebook, Twitter,
and Pinterest.
Yeah, and all that. But you click on more, and you scroll down to Instagram, YouTube, and you click on YouTube.
Oh, okay. I don't think I checked that. The other thing that I'm going to start doing, we already have people viewing our YouTube channel. Not a whole lot,
really? But
it's only been the last 2 days.
Right.
I'm going to start just making short videos of what I do on the medical show. Like I may do a 15-minute video. Because honestly, 2 hours would be a lot to do a video.
Yeah.
So, and if everybody can, if I know Weathers, if he could redo his training videos, the survival ones, on himself, and he can load it on, because I haven't figured out how to do that shit yet. With something he's loaded. If you put it on your own laptop, you can put it on YouTube. It's a lot easier. So, I'm going to start doing just the medical ones first, and then I might do the other ones afterwards, like the history ones or the weather ones. But it's more important to have the medical ones than the history and the weather and shit. And then Weathers needs to do, or whoever needs to do more of the survival ones and put on there. But I still need a video from you.
A video from me?
to do the trailer. It's a short little blurb, kind of like what we play at the beginning.
You got to show me what you're talking about, and I'll do it.
Oh, okay. Or, you know the thing that you play at the beginning of every radio show?
With
where
the
it's got
Defender 7?
A mashup?
Yeah.
It's like a mashup of, we might want to do something like that.
Well, you got to get with Hinkle because he's the one that put that together.
Ah, okay. Okay, cool.
Because he's got all that He's got that equipment.
Oh, well, he needs to get. Well, yeah, but now that he's finished school, is he going to work or is he gonna just stay at home?
I don't know if he's going to be doing what he got his degree in at home, or what he's going to do with it.
Okay. No, because I need him to. If not, he can show me how to do it, and I'll know how to do it. It's like I wanted to throw this damn computer today because I was like, I'm so tired of this crap. I'm tired of fighting with it, and I just go in and out of our YouTube channel. Just hit all the buttons. I'm like, nope. I just need to write it down. This is how technologically challenged I am. I go, shut up. I don't need your input either. I'll go in and say, hit settings, and then this, and then go to community or permissions, because I get lost. And I know it's sad. It's really sad. And
that's all right. Lorna gets lost going out of driveway.
No shit. That's Weathers.
No, that's Lorna too.
Going out of a driveway.
That's Lorna too.
So
you look me up.
Thursday show. Is there anything I'm trying to keep everything written down so we know what we've done, what we need to cover.
Right. I'm running out of. Thursday's basically like a current events. That's the only way I can explain it.
Shit.
Unless we can come up with other topics, just like Saturday. You can only do so much on training survival.
Well, I found all of those survival links that I've been posting. We can actually cover what's on those because we've never done those. So that's like 6 or 7 weeks worth for Saturday. But what is going on currently besides crap? I can't even do this anymore.
That's exactly what's going on.
But you know what? The best thing for us to do, and I do this every week, pretty much when we run out of our regular topic, is I just go on my Google, and you know the thing that goes all the way across your Google screen? I just click through it and hit current events. That's what happened today. And that's all I do. Because, that's pretty much, we can discuss what's going on with Syria and dipshit trying to attack 2 more countries.
Right.
Things like that.
I got to find out why I can't get on the one that you made.
The YouTube?
Yeah.
You've got, go on your Google, whatever Google account that you're going to use, and then you could actually log on your YouTube, not yours, but when it says sign in to YouTube, put defenders7@gmail.com. It'll ask for the password. I'll give you the password. And you can log on to our channel. yourself.
All right. 'Cause that's what I'm saying.
Yeah.
Because the only other way I can get to it is if I click on the link where you added me.
You have
But
to
I
subscribe to the channel.
I did.
Oh.
But I can't get into it.
Oh, that's because you have to log on the Defender 7 YouTube because you're a manager. So it would be like Lorna going on to the Defender 7 YouTube channel. She can't get into the backside of it where adding and deleting and all that. Yeah, you've got to actually log into the Defender 7 YouTube channel.
Because I got the YouTube app.
Yeah.
Because I told you I set up 2 pages.
You know what I'll do?
Of course I didn't know what the frig I was doing.
I'll take screenshots to show you exactly how to go, and then you can just go in there and play with it and do whatever. Because I'm like, that's the only way. That's the only way I have found. Huh?
I said, "Oh, cool pictures."
Yeah.
Yeah.
Look, it's the blind
Lorna,
leading the blind here.
Yeah, Lorna will learn real quick now.
Yeah.
I still haven't figured out if you can load pictures, except for the banner and the one I have. And the picture that I picked was because I made it for myself originally, and then I just changed the name of it. But it was the eagle, the red, white, and blue eagle, with brotherhood and sisterhood on it. That's all it has for right now. I can't get a banner small enough because the pictures that I took off our Facebook page was too big.
Huh.
So yeah.
You know what? Let me send you that picture I got. See if that's cut down to the size you need.
Okay, just put it in the staff room, and I'll go on there. But so yeah, we'll just go through. And if anybody has any ideas of what they want for the medical show, just let us know. Put a comment on the blog talk. If you want me to talk about a certain subject, more than happy to. I just figured with all this COVID crap going around that the autoimmune issues, they're the ones that are struggling. And heart conditions, which we just covered a couple weeks ago. So just let me know. Same thing with the survival. Let us know if you have something that you want to learn. And that's
or any topic.
Oh yeah.
That's what I've been putting out. Before I got banned on Facebook, but I was putting out there. Give us some ideas.
Even for the history, it doesn't have to be just American history. It could be history in general. We do them on Monday nights, and I've alternated between history and like natural disasters, like hurricanes, tornadoes, volcanoes, blah, blah, blah. Anything like that. I don't care. Mudslides, floods, you name it, whatever's a natural disaster, and we kind of alternate it unless there's something that's important that we find that's really interesting and whatever. But yeah, this is your radio show too, guys. So we're not socialists. We don't tell you what you have to do.
No.
You actually have a free opinion, except Weathers. And maybe John. They got to pay for their opinions. Yeah, they're going to pay for theirs. But yeah. And if you want, come on the show. It's not like you can hear however many people's on the line listening. It's usually just the 3 of us, maybe 4 people. So, yeah, it's not hard. So
no. All right, we're down to 3 minutes.
It took me a while. Go ahead.
Yeah, it did. It took me a while too when we first started.
I know. I was like, okay, I'm going to call. Okay, I'm going to call. Okay, I'm going to call. It took me an hour the very first time I called. So, and after that, it just becomes second nature.
Yep. It's just the way we explain it is just like being on a three-way call.
Yep. Okay,
All
Joe,
right.
do your thing. We got 3 minutes.
Thank you again for another great show, informative. I hope everybody got out of it what we put into what Kim has put into it. Just like to say, God bless everybody. God bless America, our children, veterans, our first responders, and God bless the Defender 7. Good night, everybody.
Good night.
Good night.
Oh, my ear.
Go back to sleep, Lorna.